Yeah. Speaking of people involved with the pharmaceutical lobbies,
Nope.
um, we'll just go to this slide.
Yeah.
Former President Obama visits the White House for the first time in 5 years. Um, where's my? Why do I have
And
too many things in my way? Hold on. Uh, this is the thing when you have like something looking at like nine of your monitors. You're like, where's your mouse? There it is. Um, Former President Barack Obama visited the White House Tuesday afternoon, marking the first time he's returned since leaving office 5 years ago. Obama's return was pegged to an event marking the 12th anniversary of the Affordable Care Act, a signature legislative achievement under his administration. At the event, President Biden unveiled expansions to that law. Thanks, NPR, for that tongue bath. It is good to be back in the White House, Obama said at the event with Biden and VP Harris. Nothing made me prouder than providing better health care and more protections to millions of people across the country. So when President Biden said he was not going to just celebrate the ACA, but announce actions that would make it better, I had to show up. So, you know,
hey,
the White. Go ahead.
can I just make a comment very quick?
Yes.
I find it very interesting. Like, and no one's necessarily talking about this. Like, Obama's first visit to the White House is based to essentially protect his legacy, essentially, which is the ACA.
Yeah.
He didn't advocate for Biden for Build Back Better. He didn't advocate for Biden for a $50 million wage. Nothing related to Biden he showed up for. But when it comes to his name and his
Legacy. He showed the fuck up. Right. Yeah.
Right,
Yep.
there's like he's out there, but like no advocacy at all for anything that Biden was pushing.
Yeah.
Um, I just wanted to make that. I just wanted to say that because yeah, I don't think many people. Yeah, exactly. Indy said he advocated for breaking the MBI strike, and I had a discussion about this with DJ Joe Nice last year, like the idea that you know what you can say what you want about George Floyd or whatever, that movement was pivotal, I think, especially among the Black community, not just here, but around the world, in the sense of every person watches the NBA.
Yeah.
And if they had stuck to their guns and kind of pushed ahead and kind of said, we will go on strike, the world would have taken notice. And so that's why you saw Barack Obama come out there to talk to what's his face? Uh, LeBron James and
That's
them,
it. Yep.
to reconsider their stance and essentially shut up and dribble,
Yeah.
Because they were afraid that, oh shit, like this can actually do something, And so like I hear a lot of people say like the movement was nothing, the movement was nothing. It meant something, it could have been something, but then Obama squashed it.
Yeah.
So, so it's like, and it's funny, especially given that Black Lives Matter happened under who? Obama. So, so yeah, it's just kind of funny, I think, especially in this, that Obama comes to Biden for something that he promoted when he was in office and nothing in relation to what Biden was trying to push. I
Yeah.
think it's very interesting.
Yeah. So the White House announced a proposed removal of the quote unquote family glitch, which prevents millions of families from qualifying for subsidies on health insurance marketplaces, even if one family member can access an affordable individual plan through their job. The White House estimates that fix, which is finalized, would go into effect next January, could increase insurance affordability for around 1 million people and give 200,000 uninsured individuals access to coverage. The proposed rule would amount to the most significant administrative action to improve implementation of the ACA since its enactment, the White House said in a statement Tuesday. Of course they did. It's so good. Very good. Tremendous. The best people really, really think it's great. They just don't have like the same speechwriter Trump did, you know? So Biden also signed an executive order directing agencies to continue doing everything in their power to make healthcare more accessible and affordable. What? Sorry. And affordable, and make it easier to enroll in and keep coverage. What did he's like, that's essentially, he executive signed a strongly worded letter to the healthcare companies. Is that what he did?
That's an executive order that does nothing.
That does literally nothing.
That sentence is, he literally tweeted that out verbatim, and it's so full of buzzwords. It's obviously you're doing nothing, which I'd like to point out. If you want to use the ACA to give people healthcare, you can use Section 1881 Alpha of the Social Security Act to give everybody healthcare right now, because COVID's not over yet. Now it's waning. It's going to become endemic. It already has. But according to a lot of the mainstream media, it's still raging on. You've seen them talking about it. Infections are going off the charts. Well, that's the case. It's still going on. Just give us healthcare. Why does it have to be, oh, well, all the poor people, if they want to get insured, they got to sign up for insurance, which we've already made too expensive, but to off-put the very expensive insurance, we're also going to give you a subsidy program, which you also have to sign up for to pay for the premiums and copays that were already too big. Like, why are we doing that? It's so much easier than that. And they, the answer is that they still want a whole bunch of money to go through, all these health insurance companies and through big pharma.
Yeah. Because it couldn't have possibly have worked better in any other like modern, first world country. It couldn't possibly be a better system than giving endless amounts of fucking money to people like fucking Shreky, what's his fucking name? The one who's in jail now, right?
Martin Shkreli. Martin Shkreli.
Yeah. Right.
Yeah.
Like that's
he was price gouging the tuberculosis medicine or whatever, like
right.
4,000.
And right. And insulin and like, to me, it's just, it's,
it's also funny.
Sickening.
Did you guys see that he was talking about, it's like, oh, well, we're going to cap copays at $35 a month and acting like that's a solution. It's like, that only applies to people that are already insured.
Yeah.
So they're like talking about capping how much you can be charged if you're already on an insurance program to get insulin. I mean, but also remember, not only in and of them, that in and of itself is not a solution, because of course there's, tens of millions of people who don't have insurance, which those copays and premiums don't apply to. But beyond that, Biden also revoked Trump's insulin rule, which did this exact same thing. So like they're basically putting a Band-Aid on the problem that they created. Yeah. So it's like, again, they do this all the time too, where they're like, well, copays and premiums are going up in our current system, which I created. So we're going to fix that by putting subsidies that can help you pay for the copays and premiums, which is like, no, just get rid of the fucking copays and premiums. What are you doing here?
Yeah. Like, they
don't need to exist.
Ridiculous. They really don't. They really don't. It should just be, you walk in, you're sick, we'll fix you, and let's move on. Even the ACA, the original ACA was essentially, the only thing it really did beneficial was apply some like restrictions on what insurances could already like deny you for, right? It was like,
exactly.
They removed pre-existing conditions. So they couldn't deny you from that. Like there was definitely like, some stuff there, but it was such a weak-minded thing for everyone to get super excited about. Right? When we all wanted like a fucking actual single payer healthcare of some kind. Like,
Yeah, the Republicans are like, we don't want to offer you guys healthcare at all. You have to go through private systems, which is going to cost you $1,000 a month. And the Democrats are like, well, we want you to have affordable access to care. It's only going to be $900 a month if you go through this plan. So it's like, but the people that can't afford a $900 care plan and a $1,000 care plan, that's all the same people. You're not really helping a whole lot more people. And anyway, you can keep on going. So again, it's not really helping poor people. It's really just making it slightly more accessible to, again, more like upper middle class people.
And expanding the AC was a core pledge of Biden's presidential campaign, right? Which was essentially his like anti-Bernie, like, oh no, we're just going to expand the ACA. It was like,
and before that, in the primaries, he said public option. In the primaries, when he was being pushed left, he said public option. As soon as it was down to him versus Trump, it was expand the ACA.
Public option.
So he's just breaking.
Yep. So we knew that we had to keep strengthening this legislation, Biden said. The bottom line is that the ACA is stronger now than it's ever been. Biden allotted $34 billion. Shut up, phone. $34 billion for the ACA as part of the American Rescue Plan. His $1.9 trillion COVID relief package. The plan included increasing access to ACA subsidies, though that provision is set to expire at the end of 2022. So it's essentially he's just not what do they call that? Means testing. It's just like they're taking some of the means testing off of it, right? And they're not even willing to say specifics on that, probably, you know. So
yeah, and I don't know how. I would love to see how easy it is to get access to those subsidies. Methinks the paperwork is probably draconian. They make it difficult on purpose to get the subsidies to pay for the copays and the premiums.
Yeah.
So again, it's a process that bogs down poor people's time, takes up time they don't have, rather than just making it easy. And by the way, Medicare for All would save us a ton of money. It would again be an economic boon because the taxes that they'd be taking out, the slightly higher tax rates to pay for Medicare for All would eliminate copays and premiums. So we'd actually end up saving like $5 trillion over a decade, according to the University of Massachusetts Amherst study. So again, you want to help the economy, Joe Biden? A pragmatic way to help the economy is to go to Medicare for All, and you could save the actual middle class and lower middle class taxpayers a lot of money.
So this is how marketplace costs and premiums will change if rescue plan subsidies expire. Cynthia Cox over at KFF, right? The American Rescue Plan Act, ARPA, passed earlier this year, temporarily expanded subsidies available in the ACA health insurance marketplaces. Building on the ACA's existing subsidies through the end of 2022, low-income families who are already eligible for financial assistance under the ACA are eligible for even more financial help to buy their own health insurance and pay for their copays and deductibles for coverage bought on healthcare.gov or their state's exchange. Additionally, middle-income families who are often priced out of ACA coverage before ARPA are now eligible for financial help with their monthly insurance premiums for the first time.
Again, it's like not expanding it to poor people; it's expanding it into middle-income families who are who didn't qualify for it before. So again, it's not really helping poor people.
Right.
No. I mean, if anything, it's helping middle class people, which is good, but it's like, now do the rest of them. Do everything else.
Right. Well, like if he came out and said, well, oh, we're going to expand this to the millionaire class, like Pete Buttigieg said, I'd be like, yeah, well, good, but they already can afford health care.
Afford it. Right.
So like, why are we not helping the people who need it the most, who literally can't get it? And that's, again, them taking big credit for something that is not terribly meaningful.
Yeah. So new additional subsidies were created under the ARPA as part of a larger pandemic relief strategy, but Dems have long favored similar strategies to reduce the cost of ACA plans to enrollees. And the state of California, along with a handful of other states, had already implemented its own state-funded subsidies to address premium affordability. One of the key criticisms of the ACA has been the high and rising premiums, particularly for working families with incomes over 4 times the poverty level. A little more than $50,000 for a single person, of just over $103,000 for a family of 4, who previously were not eligible. Really? Again?
Zordon wants you, bro.
Dude, he really does, bro. There's some putties and shit over in the park I gotta deal with. Who previously were not eligible for financial assistance. While the relief package did not directly address high cost sharing for these enrollees, lower premium subsidies can help them afford plans with lower deductibles. Now, there's a debate in Congress over whether to make these additional premium subsidies permanent or at least extend them for a longer time period. On the other hand, if Congress extends the ARPA subsidies or makes them permanent, federal costs would increase. On the other hand, if Congress does not extend these subsidies, premium payments will rise sharply for nearly all marketplace enrollees. Let me rewrite this sentence to, if they don't give us health care, people will die.
Yeah, right.
Like,
yeah, and again, they even admit in that previous slide, this is built into the ACA, which they're taking credit for, right? So they're saying like the ACA is amazing. It's, as you said, Obama's legacy. They tout it as being great when the only reason the premiums are going up is because they designed the ACA to be a big pile of shit.
Yeah.
So they're taking credit for only minimally solving a problem that they themselves created with something that they're now proud of, quote unquote.
Yeah. So how marketplace costs and I already fucking read that. Jesus. the ARPA subsidies are extended, federal costs will rise. The Congressional Budget Office and Joint Committee on Taxation originally estimated that the additional temporary subsidies provided under the ARPA would increase federal deficits by $34.2 billion. Most of that cost is concentrated in the first couple of years since the additional subsidies expire at the end of 2022. Through CBO expected some lingering cost as some subsidized people would remain enrolled for a time, even after the ARPA subsidy enhancement ends. The DOH and Human Services reports that ARPA subsidies for existing consumers cost $537 million per month. It is likely these costs could rise next year as more people take up coverage during open enrollment. If subsidies expire, premium payments could double for millions of marketplace enrollees. According to HHS, the 8 million marketplace enrollees who signed up before the ARPA subsidies were enacted are now paying $68 per month, after accounting for an average monthly premium savings due to the ARPA of $67. Without the ARPA subsidies, premiums would double on average for these enrollees, and they would pay an average of $800 per year more if enrolled for the full year. Premiums or deductibles would increase most steeply for the lowest income enrollees. People with incomes between 1 and 1.5 times the poverty level currently represent 42% of enrollees. And with the ARPA subsidies now paying nothing or next to nothing for their monthly premium before the ARPA, these individuals had to contribute more than 2% of their income towards the benchmark Silver Plan premium. These lowest income enrollees would therefore see the steepest percent increase if ARPA subsidies expire. Middle income individuals and families also buy coverage in the marketplace when they don't have access to job-based group plan coverage. These included people who work for small businesses that don't offer group health benefits. Gig and other self-employed workers are people who retire easily or early before the age of Medicare eligibility. We estimate that 3.7 million people, most with incomes between 4 and 6 times poverty level, gain subsidy eligibility with ARPA. Under the ARPA, the vast majority of people buying their own health insurance coverage can be sheltered from premium increases by taking advantage of the subsidies offered in the ACA marketplace. These subsidies expire, though. Middle and upper middle income people will lose subsidy eligibility, will not only have to make up the difference in the subsidy, they'll also be on the hook for any increase in the sticker price of the premium between now and January 1st. Without a subsidy, a 60-year-old's health insurance premium currently averages more than $11,000 per year. That 60-year-old had an income just above $51,000, over 4 times the poverty level. Their ARPA subsidies cover more than half of their monthly cost. Without the ARPA, their premium would increase 165%.
Can I talk about something, because it mentions the poverty level? So
yes,
if I'm doing quick math, that's about $12,000 a year.
Yeah.
Like, I lived on that. Like, out of college, I did AmeriCorps, so like we got shit. So that for me, take home. Like, fortunately, I had free housing and I had free health insurance, but like I had to take home like about $800 a month, like 10 months of the year. So like, so it's like, so the idea, and then even just the idea, like talking about four to 6 times higher than the poverty level. That's what 4 times is about 50. Like living in DC, that's nothing. Like housing is expensive, food is expensive. Everything now is a way more expensive. And like, if I wasn't working and like, through my union / district, like they're paying like 80%, of my healthcare, like I'm not sure how I'll be able to pay, out of insurance out of pocket. So, so I think just the idea that we're talking, that it's mentioning, like, it's almost kind of saying like, person making 50,000 almost kind of like is a good thing. It's not, because it's like, that's not necessarily a livable wage anymore. Especially like if you live in a blue state, and especially if you live along the coast. So yeah, it's just a mess. But basically all of this to say is, we'll give you enough that you don't have a choice to enter in the marketplace, and then we'll take it away and we'll want to force you to pay for it. Basically,
Yeah.
is what Kaiser is saying.
Yeah, and in that example they just gave, they said the 60-year-old person makes $51,000 a year, and they can look at about $11,000 in premiums. That's 1/5 of what that person makes. And what they're saying is, now what we're going to do is make this person eligible to cut that 11,000 down to about 5,500, about half.
Yeah.
5,500, that's still over 10% of what that
Debilitating,
person
yeah.
makes. Right. And then they say, well, then the other option is that because we designed the ACA so poorly, it's going to go up 165%. So would you rather pay, 165% of 11,000 is 16,000 in a year, or would you rather have 6,000? Pick your one. And again, it goes back to what I said. That's still unaffordable. You might as well be like 10% versus 30% of what you make. You still should never, ever have to spend 10% of what you make on your health insurance. That's an enormous amount of what people take home. There's so many other things they have to pay for. And then last point, if it turns out that this is all, and I don't know if this is true or not, but if it's all calculated based on what the poverty line is, like the eligibility, Joe Biden can again unilaterally, I don't think it's executive order, but I might be wrong, but I read this on Lee Camp's website. He can unilaterally change the way that the poverty line is calculated. And because it's an old way that we calculate it, the poverty line is way, way dated, is antiquated. It's far lower than it should be. So if it turns out that that's really the way that this is all, the criteria is calculated, he could change by himself the way we calculate poverty, and therefore change the outcome of the ACA if he wanted to that way. But he's not going to do that either, because again, if you change the way that poverty is calculated and you suddenly say that poverty includes everybody that makes 40,000 a year or less versus everybody who makes 12,000 a year or less, you would include a whole bunch of people who make $40,000 in social safety net programs, which they are now excluded from because they technically make too much.
Right.
Yeah.
So you could change a lot simply by doing that, Joe Biden, if you want to go this route, but he's not going to do that either.
Right. The fact that you're considered out of poverty, quote unquote, if you makes, let's say 15 as a single person.
It's dude, that's beyond poverty. You're living on dollar store food. I've been there before too. Right.
It's which when people were talking about the child tax credit, they were tuning it oh yeah, people were, you're going to get how many children out of poverty, based on what? Based on the fact that a family of 4 is making $30,000 a year, and that may, I don't know the numbers off the top of my head, but that may be considered out of poverty, out of poverty. Are you kidding me?
Yeah.
So I think just the way that we look at, and again, this is something that the squad should be saying, which they're not, because the actual poverty lines are bogus to begin with, but no one's talking about that. And instead it's this talking point of getting people out of poverty, but it's the idea of you can be poor making 50K a year, especially as a student, or you're a grad student coming out with debt, and so I think it's just the idea that we need to rethink, as Rob was saying, just our poverty guidelines and what that should entail, but no one is talking about that at all.
Well, and the other reason they're probably even talking about it is because the ARPA enhancements are set to expire at the end of 2022. Open enrollment for those begins on November 1st, 1 week before the midterm election is held. Right. So it's going to be vote Democrats or you're going to lose your health care. Even though you still don't have health care. But that's going to be the fear mongering. But yeah, I mean, standard political shit as always. If we could just have health care, please, that would be nice. Thank you.